Good afternoon, everyone in Ghana, and a good day to everyone elsewhere. I'm Dominic Akaateba, the country director of Ghana Medical Help here in Ghana. As always, this is one of our series of webinars that we've been doing for the biomedical engineers. This one is entitled Acquiring Medical Technology, the Parts and Supplies. This is being led by no other person than our own Mr. John Zienaa from the Ghana Health Services headquarters in Accra. He will be supported by Mr. Khiki Delanyo and Mr. Dr. Bill Gentles. I'll hand over to Mr. John Zienaa to lead us in this presentation. Thank you very much.
All right. Good afternoon, everyone. And thank you to Dominic for the brief introduction. Next slide. This follows the webinar outline. The first in the bullet is establish means to acquire medical technology, donations or vendors, or local vendors, processes to acquire parts and tools within your hospital, suggestions and strategies on how to justify or argue for support for technology, establishing a budget, that is revolving fund, strategies to establish collaboration with administration, that is our hospital or health administrations, and then to identify chains in the country and international support connections. Next slide. So establishing means to acquire medical technology, that's donations. The Ministry of Health has prepared donation guidelines for drugs, medical supplies, and medical equipment. And these donation guidelines actually has some sections to look at. So it says all donations should be based on express needs and be relevant to the disease pattern in Ghana. These should be based on existing and approved selective list. So on drugs, medical supplies, and equipment. So it means that before you get into handle any donations, all items coming should follow this pattern. So all donated items should appear on the national standard list. Then as we move on, drugs in particular, or must follow the generic equivalent and should appear on the list of essential drugs for Ghana. Medical supplies should also appear on the standard list available, as well as medical equipment. They must all appear on the standard list. An exception can be made for items needed in sudden outbreaks of uncommon or newly emerging diseases. The specifications of donated items should be similar to those of items commonly used in Ghana. This policy is very strict on quality assurance, and we'll look specifically on drugs. Drugs and non-drugs consumables, as households, chemicals, cosmetics, medical device must approve by the Food and Drugs Board in Ghana. For equipment in particular, approval by the Biomedical Engineering Unit of the Ministry of Health is very important and is needed. No items should be issued to patients and returned to a pharmacy shop or else given to professionals as free samples should be donated. It means that if any piece of equipment or drugs have been previously given to somebody to try, it should not be used as a donated piece of item. It's not accepted. All items intended for donation should have a minimum shelf life of 1 year or arrive otherwise mutually agreed with the recipients. All items should be labeled in English with the following information. That is full designation of the product, generic name, dosage form, composition, doses, and rules of administration. That is in you have to indicate how the should be taken. Direction for product line registration number. Form. So we should have that in British standards, the British, and there could be, if you follow the content, so manufacturing and expiry date should be clearly indicated, name and address of manufacturer, name and address of supplier, storage conditions, and warning instructions. So going to have the policy look at used equipment first and foremost. So donor shall submit the following detailed information to the biomedical engineering unit of the Ministry of Health before the item is brought in. Needed on equipment should include names of the items, the model number, manufacturer, serial numbers, and all that. So these are the policies. This is what the policies look at when it comes to equipment. And for new equipment, donation of new equipment must fit into the Ministry of Health Equipment Development Program. So donors intending to support healthcare activities in the public sector must go through this system to be able to donate new equipment. So all the equipment that are coming in must also follow the list and standards of the biomedical engineering unit of the Ghana Health Service. So we go to the next slide. That is acquiring medical technology in Ghana. So in acquiring medical technology in Ghana, local or state vendors must use any of the following routes. So you must participate in national or international competitive bidding. That is NCB or ICB. For NCB, it's reserved solely for local vendors. But for the international competitive bidding, local vendors and international bidders come in the dailies or special websites where they are published. You can go in there, take the documents, and then you can participate in the bid. Now I have requests for quotation. So in this case, they are mostly off-the-shelf items that you want to buy. You know what you want to buy, yet you want potential suppliers information and then pricing, and then you can use that to make decisions. However, we have another RFQ, which is request for qualification. It is not in this slide, but I need to emphasize on it. Request for qualification means that they are usually used for works, but in most cases, you don't know exactly what to do. You don't have the information. So you want firms that have detailed information and know a lot about the job to submit a set of information to you, and you use that to make decisions. And then firms that are qualified, you pre-qualify them. And then you use the information to now ask for these firms to now write for further participation. So that's the difference between request for quotation and request for qualification. Now you can pre-qualify to now participate. That is in the situation of request for qualification. If you are qualified, you can be asked further. When you are evaluated and you are within acceptable ranges, then you are allowed now to participate in the bid. We also have sole sourcing, where there is no other competitor to offer the needed services. Then one supplier or bidder is not allowed to offer the services. Next slide. Slide 9. Let's go to slide 9. Okay, processes may include the following. Establish a comprehensive inventory to keep and manage good database for your equipment and tools. Regular updates of your inventory will lead you to identify your needs for parts or tools. So to acquire tools, parts, and tools within your hospital, establish your comprehensive inventory. Inventory is a very important aspect of knowing what you have, how they are performing. So it keeps you knowing your database. Once you have this, you use that to prepare for acquisition of tools and spare parts. Regular updating your inventory is key. If you don't update your inventory, you will not know the performance of your equipment. What you have, whether they are performing well or not, you will not know. When you that give you an information as to how to go about acquiring tools and spare parts to get the equipment moving. Next slide. Processes to acquire parts and tools within your hospital. Clear support from your administration. So you prepare your procurement plan. In preparing the plan, you establish quantities for each item to procure. You determine the cost estimates for each item. You identify potential suppliers and obtain purchase orders or invoices. Then you establish timelines, plan with the administrator to agree and identify sources of funding. These processes are very important. If you are not able to establish the quantities of each of the items that you need, you will not be able to determine the budget for it. And determining the cost estimate for each item means that you want to know the amount of money that you will need to be able to purchase the tools or spare parts that you need. You identify potential suppliers means that there may be various suppliers, a lot of them, but who has the right items for you to buy? You need to obtain invoices and purchase orders. Or you can't just walk into your administration and start telling them that you want to acquire certain pieces of items, spare parts, and yet the sources that you are going to obtain these things are not known. They must be known. In most cases, some of the suppliers are even asked to register with the institution so that dealing with them is easier. So in most cases, your administration may ask you to go or to bring a supplier who is known already in the situation where they don't even have enough funds to buy the items on credit and later pay. Timelines are very important. There are certain, especially when it comes to consumables, that you need. If you need oils, filters, in order to keep maintaining your equipment, you need to have timelines. Because some of them have expiry dates. If you procure certain items and keep them in your shelf, they may expire. And the lead time means that if you are planning for the whole year, you need to plan such that your lead time is months and start using them. And then you know that those items may finish in the next, let's say, 4 months. So you need to start your procurement earlier so that you don't run out of stocks. And then when you run out of stocks, you're not able to carry on your jobs properly. So the timelines, plan with the administration. Every plan starts from the beginning of the year. Once you have made a plan, you have to go and discuss it for your administrators to agree with you that this plan is and it's not possible. They can always readjust to get it, make it functional plan. Next slide. So we are continuing the process to acquire parts, tools within your hospital, the clear support for your administration. So keep seamless maintenance and management records. It means that your maintenance records must be continuous. It shouldn't be break. Anytime you do a piece of work, you have to immediately record it down. Or anytime you do a step, anytime you take any action in managing your equipment, you quickly have to record it down so that you don't forget. So anytime information is needed from you, you submit a regular maintenance reports, that's quarterly, to your administrators, and discuss all critical issues. In most cases, we have found one thing. These quarterly reports are very important. Most of us will wait until when the information is needed and we start running helter-skelter to now gather information to do our quarterly reports. And when that happens, you are not able to bring in the actual facts that you need to be able to present them to your administrators. So you have to make sure that all needed information are kept and picked at any time when you are asked for. Don't wait till the last minute, then you start running helter-skelter in order to gather information. When you do that, most of the time you don't get facts to present to your administrators. Slide 12. So process to acquire parts and tools within your hospital. Parts, you can see this is a very good sample of a maintenance report. We have the asset number, written the works order number, manufacturer's model, and a host of other information. So this is a very good example of how to keep your records. And this contains a lot of data. And if you analyze this report sheet, you can then turn it into information, useful information, as analyzed kind of data. And if you are not very technical, you might not be able to make sense out of this. So to make it readable for people who are not very technical like we are, you have to turn this kind of report sample into a readable information where your administrators will understand. But I believe a lot of us have similar works in our format within our works area so that we can use this. That is why I was talking about why you have to keep your records being seamless. So if you have this kind of format in your workplace, it means that as you work along, you also keep on organizing your reporting such that you can grab this and turn it report so that you can submit the report anytime that is needed. Next slide. Okay, so we'll continue with the processes. So you have to identify your strengths, weakness, opportunities, and threats of your work. This is what you call SWOT analysis. What are your strengths? Your strengths are areas where you are very comfortable. You are able, for example, to repair suction machines without any problem. Even if you are asleep and they wake you up to come and solve a problem on the suction machine, you are able to solve it without fumbling. Your weakness, to be able to handle a certain, and don't dwell so much on this. Now you have opportunities. Your opportunities are where you are weak and somebody has strengths. For example, if you cannot repair an anesthetic machine, and you have heard that a group of specialists have come to this, and a group of specialists have come to work on anesthetic machines in the northern region. Because you are weak in repairing anesthesia machines, you take the opportunity of the arrival of this team in the northern sector, then you take advantage and go and learn something from them. That is the opportunity to handle your weakness. Your threats are those things that actually they get into your way and mess up everything you do. Those are your threats. For example, you know what to do, but you don't have money to buy spare parts. It's a threat. You have everything, you have all the skills to do everything, you have the capacity. Because of the lack of funding to do your work, everything you do is threatened. Attention by impinging. If you have to travel longer distances to other hospitals to go and work, and yet you don't have a vehicle to move, this is a need, and it's immediately, but you don't have it. But it's also impacting negatively on your work. So you need to emphasize that you need transport to be able to move. If you are lacking tools, some special tools to work on pieces of equipment, and yet you don't have those special tools, you must put emphasis to have these tools in place such that when the need arises, you are able to grab the tools and go and do whatever you have to do and do it well. So emphasis on needing immediate action, attention. You need to emphasize on areas that you need so that you can get your work going. Next slide. Suggestions and strategies on how to justify, argue for support of technology. So regular reports or records of your maintenance, repair, and technology management activities is key. Like I mentioned previously in the other slide, you need to regularly report for a piece of information from you. You shouldn't be fumbling at all. You should have it at your fingertips. Your visibility in the hospital and impact of your work is top priority. You must always be alert. You should be seen to be available all the time, whether you are working in the hospital environment or you are working as a regional engineer. You shouldn't be disappearing without informing your authority where you are. Anytime you are making a move, even if you are going to do official work, and the work is such that you will not be seen immediately around, get somebody informed that you are moving away from point A to point B. That is what I mean by saying that your visibility in the hospital impacts of your work and is top priority. Once you make your location known, even if you are not physically there, but you are visible. These days we have technology. You can either call, use your mobile phone to call, you can WhatsApp, you can send text messages. All these are strategies of visibility. Accountability of every CD allocated to you to manage technology and maintenance is non-negotiable. Of course, when you are spending any money or funding given to you, you must also keep records of, you can open a book in your computer. If you are given, say, 100 CDs to spend on maintenance and management of your equipment, you should be able to demonstrate to those who gave you the money that you spend the money prudently and show them records. If you are supposed to obtain receipts or invoices, do that so that when you are able to spend the money, you'll be able to balance your sheet. And then if an accountant or whoever gave you the money demands of accountability, you're able to show a balance sheet of how you spend the money. Next slide. Suggestions and strategies on how to justify, argue for support of technology. So keep audit trail of your activities. I can assure you that if you don't keep your own audit trail of how you spend money, When auditors come and they are doing their auditing and come across something that they do not understand, you could be called to come and then answer, because you are the one who spends whatever fund that was given to you. So keep your own audit trail. Make sure that you can audit yourself after you have spent money. You can audit yourself and make sure that you've done the right things. Be honest, confident, maintain your integrity. Honesty, you cannot negotiate with it. Confidence here means that if you are sleeping and they wake you up to come and do something in the area of your expertise, you should not be found wanting. You should be able to tell everybody what you know and how best you can do it. Your integrity is at stake. If you are not able to do this, you lose your respect. You lose your respect in your field. And that is how come sometimes you'll be working, you'll be in your hospital or your environment, and then you find other people coming in there to do the same work that you're supposed to be doing. If you are not confident from the start, your management will know that you are not confident. But then, if you are not, and you know, you have to work on it. If you can't do something on your own, there's no reason why you cannot ask for support, for somebody to teach you how to do it. Show leadership and exhibit competence and technical capabilities, and show that you are on top of your game. Yes, you have to just be competent. And whatever you are doing, do it well to the best of your ability. Convince everybody that you can do it and you can do it well. And even if you are not able to do it by yourself, you can always lead, get the problem solved as a manager. It's not everything that you are supposed to be doing it on your own or by your own, but you should be able to show that even leading the team to get problems solved, you are on top of your game. Next slide. Establishing a budget. So establishing the budget, we are going to talk about the revolving fund. So this is a concept of revolving fund. It is an allocation of seed capital to your unit for maintenance of medical equipment in your facilities. It has a percentage markups in order not to collapse it. So we were discussing this a few days ago. It's not just, the thought was that probably is it a percentage of a total amount of money that was used to buy equipment in the project. It doesn't work out like that. Some time back, we used to have maintenance allocations for the regions. It will come to the regional director's account, and then it will be divided into various facets for maintenance. Maintenance for estates, maintenance for transport, maintenance for equipment, and all that, office equipment. And within this allocation of budget of funds, the seed capital could be carved out from this for health technology and maintenance. So years back, it was tried in the Ministry of Health to get seed capital from the Ministry of Health to be sent to all the regional health directories, purposefully to use it for maintenance of medical equipment. But somewhere along the line, you face some challenges. So it didn't work. But the seed capital is something that you either, if you are working within the hospital or if you are outside the hospital and you are working in the region should be able to find you as a seed capital. Now, this seed capital is constant, but you are going to use it to serve hospitals. So as you work along, if you are giving 10,000 cities, for example, you can't just spend the time when you are going out, you plan such that to do. How are you going to do it? Then you cost it, the markup comes in. When you have to do, will cost you 50 cities. That is the bottom line. But then, if you take 50 cities out of the 1,000 cities, you will end with 950 cities. But you need to grow the seed capital. So when you take 50 cities out of the 1,000 cities, you should be able to bring back the 50 cities plus X amount of money to top up. So you go beyond the 1,000 cities. This is where the markup comes in. So if you take 50 cities, probably you want to come back with 50 cities. So you work out all the expenditures, including your hotel bill, your TNT, your traveling, all those things will include into the markup. Even wear and tear of your vehicle is part of it. So your markup could be a percentage. And when you work it out, let's say if you took 50 cities and you brought back 60 cities back into the account, you can calculate the markup of 10 cities and get a percentage out of it. But then you have added 10 cities to the 1,000 cities that you have in your account. And if you continue doing this, including the markups, with time, you grow the seed capital to a certain amount of money, which is no more 1,000 cities, but maybe 1,500, 1,006 to 2,000, depending on how long you're operating successfully with this revolving fund system. Next slide. Slide 17. Okay, so in doing that, I've already spoken about, but let me expatiate a bit more. All items must be subjected to appropriate costing. So your spare parts, your consumables, your accessories, traveling and transport, accommodation, fuel, lubricants, coolants, and transmission fluids. So you have to cost all this. And that will come from your principal, the 50 cedis. And when you have done that, then you put the markup on all these items. And that markup will make sure that you are not collapsing your fund, but that you are growing it gradually. Next slide. So you always have, you'll be given a sub account to operate in. So when you establish the revolving fund and the seed fund is given, you have a sub account because you will not be given a main account to operate on. All accounts are under the regional director of health services. That is if you are working as a regional engineer. But if you are working in the hospital, all accounts are under the medical director or medical superintendent, and you can't have your own account. But this sub account that will be given to you, you are operating it and you monitor it. You make sure that that account is monitored properly by you, because there will be an account officer you'll be working with. And anytime you're taking money out of it and putting money into it, will be monitored by you. You are not going to sign any checks. They will not allow you to sign any checks, but you are a custodian of that account, and therefore you must make sure that the account is working properly. Nobody can take money out of it without your permission, even though you can't sign, but they can also take money out of it without you sanctioning that. All waste received must be properly assessed and assign costs to them. So all the works that are coming into your jurisdiction for solution, you must cost them properly. Be effective in the costing. If you don't cost them well, you are going to end up by depleting your seed capital. So if you are not good at costing, you can get somebody who is good at costing to help you. You must always prepare budgets for works to include all items and add the agreed markup. So obtain approval from your administration before you proceed. So whatever plans that you have made with your costing and everything, let your administrator, your immediate boss, let him have a look at it and approve of it. Because if you are going to send a bill from your administration to a particular hospital, you get there, if they are not satisfied, they will call back to your administration to find out whether you are not coming there to build them privately. So in this case, all your documentation must bear government headings. If the GRA, let it be GRA. If not, let them issue a special document receipts. It can be from the Regional Health Directorate, but it must bear government logos. Don't go in there with private, documentation. Even if you are going there and document that you are holding are private, due to maybe some accounting procedures, you can always obtain permission letters from the administration, such that by the time you get to the next place where you are going to submit the bill, it's clear that you are not coming to build them privately and put the money in your pocket. Once you do that, you are clear. Next slide. You submit the budgets to those requesting you to maintain the equipment for them. I've already made this point. So discuss and be sure they are ready and willing to pay when work is complete. This is very critical. Before you even go in to do the work, you always have to discuss with the institution requesting you to do the work. Discuss with them. If they are not willing to pay for the bill after the work, you can always find it out from their demeanor. You can find it out. And with your experience, you can tell whether they are ready or not. If they are not ready, you can always find another strategy to keep them, get the work done, but they must pay the money before you even release a piece of item to them. Good bookkeeping practice is key to its survival. Bookkeeping here, we are not talking accounting, but make sure that if you are working very closely with your accounts officer, he knows how to keep the books, but you also have to keep an eye on how the book is kept. Get regular updates for your income. Anytime you take any amount of money out of it, get records. When you bring in money, get records. Just, a regular looking at how money is coming in and going out is what may be termed as good bookkeeping, making sure that nothing is left out and nothing is taken out without your knowledge. No indebtedness by any debtor shall be tolerated. If you don't make sure that those owing you are not paying the money, sooner or later, all the seed capital will be gone and you don't have anything to work with. So make sure that wherever or whenever you do work for any institution or facility, even if it's within your hospital, and there is a system that you are operating whereby the units within the hospital will be given monies to, get their piece of equipment repaired. If there's a system like that, make sure that every unit within the hospital where you have done works for are able to clear all their debts. If you are a regional engineer, make sure that the particular facilities you are working for, make sure that any works you do for them, they pay all your money to you before you go in to take another set of work. And you must always discuss this seriously with your administration and the administration of the other side. Make sure that the two of them are talking to each other and knowing the importance of you not losing the seed capital, because when it collapses, it is you they will come back and ask, they gave X amount of money to operate and the money is gone. Where is it? So don't give any chance out for blame. There's no blame game here. Make sure that they are very straightforward with how to operate the account, the seed capital. Bills submitted must be paid within a agreeable period of time. This, I'm not referring to bill gentles, but I'm talking about when you do works, you have to submit a certain expenditure to the institutions. That's why we refer to as bills. I know in Ghana, it's a term that is very familiar with us. So when I say bills, I think my colleagues understand what I mean. Once you submit the bills, they must be paid within a period of time that is agreeable. Of course, if you do works and then you send the equipment or whatever you have done, probably they'll ask you to give them some time before they can, work out all the details so that they'll be able to get money to pay. Sometimes they'll tell you that, our health insurance, they haven't paid us yet. So can you give us maybe a month or two? But that period of time, your bills must be paid. It shouldn't go beyond that. If it is going beyond that, start putting pressure, so that you don't lose your seed capital or your operational capital. Next slide. So strategies to establish collaboration with administration. So some of your strategies may include regular interaction with head of administration to discuss one, technical challenges. So that is why we are there. There's no way you can be in an institution working and you not have technical challenge. There will be a number of them that you yourself can imagine. Some of them will be obtaining spare parts, for example. You may not be able to obtain some of the spare parts locally. You may have to procure them offshore. Probably getting enough funding to do the work. You may have your own challenges of not being able to solve a particular problem immediately on your own. You may want to fall on somebody else to help you. These are all challenges, but don't keep them to yourself. You have to discuss and let your administration know your challenges. If it is transport that you need to move to go and do something somewhere, and you are finding challenges, probably you have only one vehicle in the hospital or in your region. Sometimes what you do is, if you are working as a regional engineer, I keep on referring to it because due to certain reasons, you may have a call, say if you are working in Upper East and you have a call in Zebula to go and work, and your vehicle is not working, it's a technical challenge. But then, if you hear that some officers or an officer is going toward that direction to the same hospital, you can ask and find out whether you have space in that vehicle to go and solve the problem and come back with them. If you are not able to do any of those things, just let your administration know why those things cannot be done. So share your success stories. Those things you have done well, let people know. Don't do them and then keep them to yourself. In that case, nobody will know what you have done well. As they always say, as for man, our good deeds will be written at the shore of a sea, but your bad ones will be written on rocks. So you have to tell your own success stories. Let people know what you are doing. You can write articles. If I'm not talking about articles that you will write for the whole Ghana to know, but even I'm sure there are some magazines or some routes of sharing information within your facility or within your working area. Let people know that you are also doing well. Blow your horns a bit. And lead all technical discourse on technology. In fact, you are the professor there. It is you who let people know technically what is good and what is not good. People will always fall on you. If they are going to procure technology, you are the one they will fall on. And if the technology fails, it means you didn't give good advice. So whatever you are doing technically, make sure that your discourse is straightforward and then clear to everybody. So when people call you to come and lead in discussion technically, you have to abreast yourself with whatever you are going to say, whatever you are going to tell them. Most often, if there's something you don't understand very well, you can always go read about it or talk to friends who know about it, and then get yourself very well versed in it before you go to talk to somebody about technology. Next slide. All right. So identifying supply chains in the country and international support connections. So the Ministry of Health and the Ghana Health Service are the main agencies that procure and supply medical equipment to public sector health facilities under the government of Ghana. Apart from donations from other health partners, these are the agencies that invariably or largely supply medical equipment to facilities, that is government health facilities. The private sector have their own way of supplying the equipment, but when it comes to government sector, which we are all players, these are the main agencies that supply equipment. Next slide. So we have other donors and agencies that include our health partners such as Ghana Medical Health, for which reason we are all here today doing this webinar. Khiki is a Korean-based health NGO, and they are doing very well in Ghana. They do supply a lot of equipment to our health facilities. We have our own WHO. MedShare is based in Atlanta. For a few years back, they have helped us a lot in also supplying and donating medical equipment, just as Ghana Medical Health is doing. They have done quite a lot. Next slide. So our local suppliers in Ghana, they include, these are not all, there are many more, but just a few sample of them. Hanisa Company Limited. Some years back, they were a major supplier of medical equipment in the Ghana Health Service or Ministry of Health. Then we have Beautiful Creation Company Limited. They have Transas Company Limited, Universal Hospital Group, Benko Hospitex, and Baron. They are all medical equipment suppliers. But as I said, there are many more others beyond this. I'm sure in the yellow pages of Ghana, if you find that big book, you'll find many more other suppliers. And new ones have even also registered with the Register General to also come into the sector and play. But these are just a few of them. Next slide. So, in identifying the supply chains in the country and international support, we have these website addresses that were very useful to this presentation. So maybe in your own time, if you have time off, you can Google some of this and find out what is there. Next slide. Yeah, it continues. It's a continuation of the other slide, or website addresses, and how some of the information we also picked for this presentation. Next slide. So we have the last one as discussion and questions. So thank you very much for listening to me.
Thank you, Mr. Zienaa. That was an excellent presentation. We're very grateful for your time and for your energy in putting this together. We need your help in planning the next webinar. So many of you in Ghana have asked for more training on how to maintain and repair oxygen concentrators, suction machines, and portable autoclaves or sterilizer machines. So we need to know what models of these devices do you have at your hospital? So we need your help in order to do this webinar, this future training. I need you to please go to this link. It goes to a survey where you can type in the model types of your 3 devices here. That would be very grateful. Without your help, we can't do this webinar. So if you want that training, please get this survey completed. We're trying to get as many as possible. And then next slide, Bill. And then, as always, we try to get evaluation feedback on our webinars in order to ensure that we're doing a good job and that they're needed and wanted. So we need you please to complete this survey that evaluates our webinar. The link is here. And at the end, you'll see on the survey, you can add your name and your email for attendance, because individuals who attend all of our webinars get a certification of attendance in this training. As well, we're going to enter the participants into a draw for who's going to win a toolkit. So if you attend all the webinars, either live or if you just watch them online and then submit the survey after, you can still be included in this draw that we'll do probably at the end of this year to win a basic engineering toolkit from Ghana Medical Help. So please do this evaluation and please do the other survey too. We'd be very grateful for your feedback. And thank you for your time and your energy. Thank you, John. Again, we're very grateful. Thank you, Dominic, for the introduction. Thank you, Bill, for hosting. If there's nothing else, everyone have a wonderful day and stay healthy in the pandemic.